Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and on the drive today, I am excited to talk to you guys about indigestion and perimenopause. Now, we've gone over bloating, the whole bloat thing before in perimenopause, but today we're going to talk more specifically about indigestion, so I'm happy to share some of these experiences and things that I've learned for you during my clinical practice. So, and in all fairness, it's not that what we're going to talk about, this type of indigestion, is specific to perimenopause, because it's not really directly related with the hormone changes. However, around the time frame of perimenopause and menopause is also around the same time frame where you start to see other changes in the bodies. And in this case, we're talking about how your digestive system with age weakens. So the point of this is that we can address this and strengthen your digestive system, because the digestion system is the core and like the root of your health. If you have a poor digestive system and your absorption is poor, it's very difficult to have a good immune function. You'll see a decrease in your detoxification systems. So a strong digestive system, especially when you look at a lot of historical types of medicine and historical therapies like Ayurvedic medicine, digestion is like the key. So we really want to talk about that and strengthen your digestive system. Especially too, because when you go to your medical doctor for a lot of these symptoms, what they often prescribe is the exact opposite of everything that we're trying to accomplish from a naturopathic standpoint. So what they often give for this is our what are called PPIs, or proton pump inhibitors, and this blocks your body's ability to produce stomach acid. And in this case, the majority of the time, you're not producing enough stomach acid. Now, I'm not saying that every single case of indigestion is not enough stomach acid, especially like say in kids and in youth. But it's still, PPIs are rarely the answer, and when they are used, they're only supposed to be prescribed for 2 weeks, not 2 months, not 2 years, not a lifetime, because of the side effects associated with them. So what we want to talk about is how we can correct these symptoms by increasing your digestive strength, not blocking your digestive strength. So there's 6 points we're going to go over. 2 separate factors to improve your digestive strength. So the 6 points are divided between what to do with or before a meal, and then what to do after a meal. Okay? So point number 1, the first 3 points are what you should be doing with your meal or right before your meal to improve your digestive strength and therefore reduce the indigestion associated with this phase of your life. So, and then we're going to start with the most simple treatments and then get into a little bit more complicated. So you would actually use this in order. So if point number 1 doesn't work, then you can move on to point number 2 and then on to point number 3. So point number 1 is apple cider vinegar and or warm lemon water. So this is just a very simple digestive aid that you can use that can help your body before a meal to stimulate a few more digestive enzymes to be released and to improve your production of stomach acid. And when you do this, you'll get an improvement in this indigestion. Because when you're not digesting well and you're getting a little bit of this bloating and feeling, it's because foods, instead of digesting, they're just kind of sitting there. It's slowing your transit time out of your stomach, and it's leading to this bloating sensation and this discomfort, which can lead to other issues further down the bowels, like constipation or loose stool, depending on how you're responding. So point number 1, apple cider vinegar and a little bit of warm lemon water before your meal, just to stimulate your digestion. If you're not seeing enough improvements with that, then you want to go to bitters. And there was a herbalist I used to follow named David Winston, who was a brilliant herbalist, and he had talked about if there was one thing, he could only pick one thing he could prescribe people, and that was all he was allowed to choose, he would basically pick bitters. For the same purpose. If you improve digestive strength, you're improving everything. So, and the nice thing is with bitters is that bitter herbs, they stimulate your digestion a lot more than just apple cider vinegar. There's herbs in there that if there's any type of overgrowth of yeast or inappropriate bacteria, those same bitter herbs can help to kill those off. And some of them are also anti-inflammatory for your digestive tract. So a good bitters formula that's well balanced is I've seen some amazing things happen in practice with the use of that formula. So there's Swedish bitters, there's Canadian bitters. Generally speaking, you want to pick a formula for bitters where there's some warming bitters in conjunction with it, like things would be included like angelica or some dandelion root, or sometimes they put some orange peel in there, as opposed to just cooling bitters. So find the blend of both. And I know I've got more information about that at ablehealth.com, so you can check that out. But bitters is amazing. And lastly, digestive enzymes. And this one would be in a case when the digestive system is really off. And I would also say that when you're using digestive enzymes, and I wouldn't use that as a switching, so bitters didn't quite cut it, so I'm going to switch and then go replace it with digestive enzymes. I would use it as an add-on, because that's how strongly I feel about the bitters. So you'd use that, and then if there's certain meals, things that are going to upset your stomach, ideally don't eat those meals, but in those situations, you add digestive enzymes to your meal. So this is talked about a lot in some practitioners, holistic practitioners who work a lot with cancer cases, and at that point, they really, really need the person to be absorbing and digesting everything, because they're fading and they're losing their strength and they're losing weight. They use bitters and digestive enzymes. So again, don't hesitate to use both, but I wouldn't switch. I would never cut out the bitters. So that's the 3 things that you want to consider before a meal. But the thing is, there's things that you can do after a meal. Something I should have touched base on earlier is that the things that I'm talking right now, these are not new concepts. Like if you go to, for instance, go to the liquor store, and they have formulas, or formulas. I guess they're not formulas. Now it's just booze. But they have things there that are called, there's aperitif and a digestif. So, for instance, the one that everyone knows is Jägermeister. Jägermeister is a bitter. It was designed as a bitter. And these alcoholic drinks, the alcohol would preserve the herbs, and then they would have a specific alcoholic drink before the meal, and then another one after the meal, and they're using one herbs to stimulate digestion and the other ones to kind of soothe it. So what we're going to talk about now is how to soothe it after you've eaten. So a perfect example of this would be fennel or anise seeds. And if you've ever been to like an East Indian restaurant, and then as you're leaving, they always have this little dish of seeds there, and generally they're little green seeds, and they taste like a licoricey kind of flavor. Those are fennel seeds, and there's usually a purpose of a sweet flavored herbs. That's why I even consider like desserts and stuff after, like a little bit of sweetness was to help soothe your digestion. Now at this point, like we don't even know what a little bit of sweetness is. Our tastes are like so perverted with the amount of sugar and stuff that we have compared to back then. It's not even comparable. So just focus on a little bit of sweet herbs. So fennel or anise, these little seeds, and you can just keep a little like tiny baggie in your purse. People are probably wondering about that, but it does work really well, and it really soothes the bowel. In fact, in Egypt, anise seeds the translation was comforter of the bowel. Like that's how well they work. And I remember I had a case, and the person just came into my office for another reason, and then while they were there, like, oh, sorry, I can't sit here like this. My digestion is I got terrible cramps. So I was like, well, they were sitting there. I just gave them a bunch of anise seeds to chew on from some of my tea jars, and by the time we were done talking, their digestion was feeling better. So anise seeds and fennel seeds, just try. If you don't like the flavor of the black licorice, just try and get over it, because they work so well. And speaking of black licorice, that's the next point, is that a tea, having a little bit of teas, like herbal teas after a meal, for point number 5. And this would be things that also are anti-inflammatory and soothe your digestion. So licorice itself, you could take the anise or the fennel, put those into a little bit of a tea form. Ginger would be a really good one, or mint. Now, if you have severe heartburn, then ginger and mint sometimes can be a little much. But otherwise, if that's not an issue and it's more of an indigestion, which means like a discomfort or it's like cramping or just feels like everything's just sitting there, some ginger and mint can work wonders as a tea. And then lastly, point number 6, after you eat, instead of just passing there and lying out like after a giant Thanksgiving meal, take a short walk. Like don't exercise after a meal, but just a short walk. And it's also kind of a good way to reinforce the idea is that if you're eating so much that for a meal that the thought of going for a walk after it just sounds like a terrible idea, then you're eating too much for that meal. I know in Amish and Mennonites, I was listening to them talking about some of their health practices, and one of the things they always do is that they never eat until they're full. You only ever eat until you're 2/3 full. And then that's also kind of a weird concept. It's like, how do you measure when you're 2/3 full? But if you ate so much that you're like full and you can't go for a short walk, then you ate too much. So eat smaller amounts and then go for a short walk after you eat, and it just kind of helps get things moving so that it's not just sitting there and causing that bloat and discomfort. So let's review some of these 6 points and the way to do it. So before the meal, you can either try apple cider vinegar and some warm lemon water. If that's not enough, you can switch to bitters. And if that's not enough, then you can add to the bitters the digestive enzymes. And then after the meal, if you're looking for something really convenient to carry, a little bit of anise seeds and sweet seeds, which you can pick up at like a bulk barn or a health food store, keep those in your bag or your purse, and then chew some, just like a teaspoonful of those after a meal. It will go a long ways. If you have the option and you're at home and you've got some teas, then you can try licorice, ginger, or mint, and then take a short walk after you eat just to help get the food moving so it's not just sitting there and causing that discomfort in your stomach. That can go a long ways. So if you want to learn more, you can check out my websites, Able Health or Able Beta. Check those out. I'll get more details as we release more on those websites. And I hope this was all really helpful. So this is Doc Yates, and I am signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.